Have you ever ignored the small signs your body is giving you, thinking it's just a passing discomfort? If you are someone you love is navigating the challenges of aging, particularly with prostate issues, you need to listen closely to what your body is telling you. Ignoring these early warning signs might seem harmless at first, but it can lead to serious, even life-altering health problems. In today's video, we'll be diving deep into the critical habits that older men with prostate issues need to avoid, habits that could worsen symptoms, increase the risk of complications, and impact not only physical health, but emotional well-being too, from neglecting hydration to sitting for too long. These habits could be unknowingly sabotaging your health. But don't worry, by the end of this video, you'll have the knowledge and simple strategies to take charge of your prostate health and overall vitality. Stick with me until the end, and you'll learn practical steps that can transform your daily routine and ensure a healthier, more fulfilling life as you age. If you haven't subscribed to our channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated on all our latest content. I'm eager to hear your thoughts on today's topic. If you enjoy the content, please comment one below if it doesn't resonate with you. Leave a 0. Your feedback is crucial, as it helps me create better videos that align with your interests. Now let's get started, Ed. One of the first things that an elderly person with prostate issues should avoid is ignoring the signs that the body gives as men age. One of the most vital and often overlooked aspects of maintaining health is truly listening to the subtle yet powerful signals that the body sends for elderly individuals dealing with prostate issues. Ignoring these signs can be a dangerous path, one that often starts with a seemingly insignificant discomfort or slight change in routine. At first, it may seem trivial, just a fleeting discomfort or small inconvenience. But dismissing these early warnings can lead to far more serious, even life-altering consequences. Prostate health is not just a matter of physical well-being. It has profound emotional, psychological, and relational implications as well. The prostate, though small in size, carries an enormous responsibility in a man's health. It is deeply interconnected with both the reproductive system and the overall function of many bodily processes. When neglected, it can transform into a silent, insidious problem, slowly robbing a man of his vitality, dignity, and peace of mind. Conditions such as benign prostatic hyperplasia, BPH, may progress unnoticed quietly, interfering with daily life and causing unnecessary distress in more severe cases. The consequences of neglecting these early warnings can be devastating, leading to the development of prostate cancer, a diagnosis that can send shockwaves through one's life and emotional world. The profound impact of such an illness can affect not only the body, but also the mind, potentially spiraling into feelings of fear, confusion, and helplessness, in addition to ignoring physical warning signs. One of the most damaging habits that elderly individuals often struggle with is poor nutrition. The consumption of processed fatty foods, laden with salt, may seem comforting or convenient, but the toll it takes on the body is immeasurable. These foods contribute to chronic inflammation, not just in the body's tissues, but directly affecting the prostate. It's not just about weight gain or physical appearance. It's about preserving the integrity of a vital organ. The more one indulges in unhealthy eating habits, the more damage is done, not just to the body, but to the soul, as feelings of fatigue, discomfort, and sluggishness take over. However, the power to change lies in making intent choices at every meal. Studies show that a diet rich in vegetables, fresh fruits, whole grains, and healthy fats can act as a shield, drastically reducing the risks of prostate issues and other related health concerns. Every choice at the dinner table can either nourish or harm your body, and by extension, your quality of life. And then there's the silent, often invisible enemy of physical inactivity. The temptation to remain sedentary, to avoid movement, becomes stronger as the years go by. But what's not always evident is the toll this takes on the prostate, the circulation, and the overall energy of the body. A sedentary lifestyle contributes not only to weight gain, but also to sluggish blood circulation, which is essential for the health and functioning of the prostate. The power to reclaim control over this situation lies in the simplest of actions. Moving the body, regular gentle exercise, such as daily walks, can be transformative. Not only does it relieve pressure in the pelvic area, but it also boosts blood flow, improving organ function and energy levels. Exercise is an act of love for your body, a quiet affirmation that you are worthy of care, attention, and vitality. The combined effect of paying close attention to your body signals, making mindful food choices, and incorporating regular physical activity creates a powerful foundation for a healthier, more fulfilling life. These steps may seem small, but they are transformative together. They can help prevent suffering, promote emotional well-being, and bring a renewed sense of strength and peace. Every effort, no matter how seemingly insignificant, contributes to a brighter, healthier future. Taking action today is not just an investment in your body. It's an act of self-respect, a promise to honor your health, and an affirmation that you deserve the best life possible, no matter your age. The second critical factor that elderly individuals with prostate issues must address is the often overlooked danger of dehydration. As we age, It's common for many to reduce their liquid intake, largely driven by the fear of frequent trips to the bathroom. While this might seem like a practical solution to avoid the discomfort of constant urination, it is in fact one of the most harmful habits a person can adopt when it comes to prostate health and the well-being of the entire urinary system. When the body does not receive enough water, the consequences are far-reaching. Urine becomes more concentrated, which can irritate the bladder, making it inflamed and more prone to infections. This increased concentration also exacerbates existing prostate issues, leading to heightened discomfort, urgency, and even pain. Inadequate hydration compromises the body's ability to flush out toxins, placing an immense burden on the kidneys and increasing the risk of further complications. The prostate, being an organ dependent on fluid balance, can deteriorate faster when the body is not properly hydrated, leading to a vicious cycle of worsening symptoms and declining health for those struggling to drink large amounts of water at once. There are simple and effective ways to maintain hydration without overwhelming the body. Sipping small amounts of water throughout the day can be incredibly beneficial. Alternatively, natural herbal teas, caffeine-free and sugar-free options, as well as diluted fruit juices, can be wonderful allies in achieving the necessary hydration. These beverages not only help keep the body adequately hydrated, but they also soothe and nurture the system without the harmful side effects of sugary sodas or excessive caffeine. This practice of consistent balanced hydration does more than just support the prostate. It enhances the overall function of the body. Proper hydration improves circulation, ensuring that vital nutrients and oxygen reach the organs, while also facilitating the removal of waste products by nourishing the body with the right liquids. In the right amounts, elderly individuals can experience increased vitality, improved energy, and greater clarity of mind. It helps restore harmony to the body, allowing it to function as it was meant to, with less strain and greater ease on the flip side. It is equally crucial to avoid the excessive consumption of drinks that dehydrate the body. Coffee, sodas, and alcoholic beverages, though often enjoyed for their stimulating effects or taste, have diuretic properties that actually increase the loss of fluids. These drinks can intensify urinary issues, leaving the body in a constant state of dehydration. While they may provide a temporary sense of energy or relaxation, their long-term effects on hydration are damaging, particularly for those dealing with prostate issues. The simple yet transformative act of choosing the right beverages, hydrating liquids in moderate amounts while avoiding those that drain the body of its precious fluids, can significantly impact one's overall health. In doing so, elderly individuals will not only protect and support the health of their prostate, but they will also improve their vitality, mobility, and quality of life. It's a small, everyday decision that pays off in lasting well-being, allowing the body and mind to thrive in greater harmony. The third essential habit that elderly individuals with prostate issues must avoid is holding urine for extended periods. While it might seem like a harmless or even convenient choice in certain situations, repeatedly delaying trips to the bathroom can have deeply harmful consequences for both the bladder and the prostate, leading to a cascade of health problems that can significantly affect a person's daily life and well-being. It's crucial to understand that holding urine is not just an uncomfortable inconvenience. It's a practice that places an incredible strain on the entire urinary system when the bladder is forced to hold on to urine for longer than it should. It begins to stretch and weaken, which can have serious repercussions. As the bladder fills beyond its comfortable capacity, it increases pressure on the pelvic area, including the prostate for those already suffering from prostate issues, such as benign prostatic hyperplasia, BPH. This added pressure can worsen symptoms, leading to increased discomfort, pain, and difficulty. Urinating the prostate, which is already enlarged, and maybe be causing symptoms like frequent urination or a weak urine stream, can become even more strained, making the entire situation more complex and challenging to manage. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Over time, the repeated retention of urine can lead to the weakening of the bladder muscles, impairing the ability to empty the bladder fully. This issue is particularly problematic for elderly individuals whose muscles and tissues are naturally less resilient as the bladder becomes less efficient at emptying urine, may remain trapped inside, increasing the likelihood of urinary retention. This condition can lead to more frequent bathroom trips in the future, but with less success in actually emptying the bladder. This vicious cycle can also contribute to the development of urinary tract infections, UTI bladder stones, and other complications, which only serve to further weak the system and worsen the health of the prostate. Additionally, holding urine for extended periods can contribute to the development of overactive bladder syndrome, a condition characterized by sudden, intense urges to urinate, often with little warning. This condition can cause anxiety and a constant sense of urgency, disrupting daily life and making even simple activities feel challenging for someone. They can carry significant risks when used improperly, especially for individuals dealing with prostate conditions. Pain medications and anti-inflammatory drugs, often used to address common complaints like joint pain, or urinary discomfort can have unintended consequences for prostate health. Certain medications can exacerbate pre-existing prostate issues, either by increasing inflammation or by interfering with the delicate balance of hormones that play a role in prostate function. In some cases, these medications can worsen symptoms like urinary retention, which is already a concern for those with prostate problems, by further hindering the ability to urinate freely. Even natural supplements, often viewed as safe, alternatives can carry hidden dangers. Many supplements, including those touted for urinary health or inflammation, can interact negatively with other medications or treatments, complicating an already delicate health situation. One of the biggest risks of overusing medications without guidance is that they can mask critical symptoms. Pain relievers or anti-inflammatory drugs may temporarily reduce discomfort, but they can also hide warning signs of more serious issues, delaying important diagnosis. This can lead to missed opportunities for early intervention, making it more difficult for healthcare providers to track the progression of prostate-related conditions or to identify complications in a timely manner. In cases where symptoms are alleviated without addressing the underlying cause, the opportunity for proactive treatment is lost, which can have long-term consequences on overall health. Additionally, certain medications can have a direct impact on circulation in the pelvic area, a crucial factor in prostate health. Poor circulation can contribute to a variety of prostate issues, from urinary difficulties to discomfort and inflammation. Some medications may inadvertently hinder urine flow, causing the bladder to retain urine for longer periods of time, which can exacerbate existing prostate issues and increase the risk of urinary tract infections or bladder complications. This vicious cycle of symptom masking, coupled with potential negative effects on circulation, creates an environment where the root problem remains unaddressed, potentially leading to more severe complications down the line. The key to safely managing prostate health is always to seek professional medical guidance before starting any new medication, including over-the-counter drugs or natural supplements. The body's response to medications can vary widely from person to person, and what may be effective for one individual may be harmful to another, especially when it comes to sensitive conditions like prostate health. A healthcare provider can assess the situation thoroughly, recommend appropriate treatments, and help identify potential risks based on the individual's medical history and current medications. This ensures that any treatment plan is not only effective, but also safe, preventing adverse reactions or unnecessary complications. If you are still watching this video and find these lessons useful, please comment number 2 below. to let me know that you are still watching this video with me by taking a responsible approach to medication. Individuals can better protect their prostate health and overall well-being. When managed correctly, medications can offer relief and support, but it's vital that they be used in conjunction with professional advice to ensure the best possible outcomes. This approach can help avoid unnecessary risks, minimize side effects, and preserve quality of life. It's always better to on the side of caution when it comes to managing health, especially when dealing with delicate conditions like prostate issues. Being proactive about medication use, seeking proper